Statistics from the American Cancer Society say that breast cancer is the second most common cancer for women in the U.S., just behind skin cancer. Thanks to mammography, though, more cases have been found in earlier stages when chances of survival are better. Here with us is Dr. Michael Ulissey from Breast Diagnostic Center to explain the difference between the various types of breast cancer screenings. Welcome. I'm so glad you're here.
Well, thank you.
You can explain this to me. I lost my mom to breast cancer. We have a family history, and so, you know, I'm always extremely interested in what it is we're supposed to ask for. You have 3D mammography at your office. Tell me why that is so much better in terms of diagnosing cancer early.
Well, I think it goes to the inherent nature of a mammogram and women's breast tissue. Some women have more dense breast tissue than others, and I'll show some pictures of that in just a second. But mammography is a 2D type of a picture. It's basically an X-ray photograph of a woman's breast. And so if a woman has a lot of background natural white, normal tissue on a mammogram is white, breast cancer on a mammogram is white, we have to tell the good white from the bad white. If you have dense breast tissue, it means you have a lot of natural background white tissue, and that can hide a small breast cancer. It'll eventually declare itself on a mammogram, but maybe 1 or 2 or 3 years down the road, where it's a little bit more devastating as opposed to catching it earlier. What 3D mammography does is it has a way to reconstruct breast tissue in a 3D mode so that we can look behind the dense breast tissue and try to find the cancer. If we look at these mammograms over here, the one on our far right has low density, medium density, and then high density. Normal tissue is white on a mammogram, breast cancer is white on a mammogram. If I had a breast cancer the size of my pinky fingernail and it was in the background of a lot of gray, it would be easy to see. But if I had one that same size and it was in the background a lot of natural background white, it would be more difficult to see. And with 3D mammography, we can then look behind that dense white tissue and find those cancers smaller.
That would also save people. That's also my problem. That would save some of us from a lot of needle biopsies and that kind of thing.
It does two things. Not only does it detect breast cancer when it's smaller and earlier, but there are a lot of times women get called back for the unnecessary biopsy or the unnecessary recall. And you say, well, the doctor read your mammogram, wants to take a closer look at something on the right side. Can you come back, you know, tomorrow or something like that? And that is scary. It's scary for, you know, a couple days, couple hours, whatever the amount of time it takes. But we can actually, with 3D mammography, something looks suspicious initially on the standard 2D digital mammogram, look at it in 3D mode, and we say, you know, that's actually nothing. It's just summation shadow. It's overlapping pieces of breast tissue that look worrisome, but and we don't even give the woman the phone call then. We generate a normal report.
Now, what are we looking at here?
Well, basically, if you look at the natural background gray-white texture, a lot of white, dense breast tissue, digital mammography, the 3D mammography, will cut that mammogram essentially in series of slabs and series of slices. We'll look at those individually, and that's where we'll be able to. And we have a picture of a 3D. There's actually two mammograms to go. Oh, okay, yeah, this is the actual mammogram tower. And what that does is it moves back and forth, and that's how it reconstructs those images. If we go to another picture where we've got two mammograms together, and I think it's 2009 and 2011. Yeah. Okay, normal tissue is white, breast cancer is white. One way is to compare year to year.
Right, last time to
I've got 2009 and then I believe that was 2011. And essentially they look relatively the same. I don't see much changing in areas of white. But if we go into 3D mode, which I think is the last video loop that we'll be seeing.
Okay, we'll be taking a look at that. Then you can really tell what you're looking at.
If you can actually put that into a loop, you will see an area right there. Right there is an area that's sticking out like a starburst. Go through that loop again, and right there at the top,
oh my gosh,
there you go. You see an area of starburst. That actually turned out to be a sizable breast cancer that was hidden, and we wouldn't have picked it up if we didn't have 3D mammography. And so that's where the technology can really help women.
Does everybody qualify for 3D mammography?
Yeah, everybody. We do it on every one of our patients. We have actually picked up small cancers in relatively low density breast tissue because we had 3D. We've had that in for about 2 years now. We were the first center in the Tacoma, Auburn, Federal Way corridor to put it in. We put it in 2012, largely because my partner and I did the research, helped participate in the research. I used to run one of the largest cancer centers in the U.S. at the medical school in Dallas, University of Texas Southwestern. I was director of their breast center, and we did the research that validated 3D and got FDA approval.
I'm so glad. I mean, no doubt you've saved lives. When would you recommend an ultrasound breast screening?
So for women with dense breast tissue, mammography is not perfect. There's no study in medicine that's going to be perfect. Even with 3D mammography, we can pick up things smaller. But there are some women who just want additional peace of mind. They've had some sisters or mother or some other family member or close friends, and they say, you know, I've got dense breast tissue. I know a mammogram is the best test, but I want something more. I'll spend more on a pair of shoes than on an ultrasound, and so I want to do an ultrasound as well. Ultrasound is not a replacement for a mammogram. In fact, mammography catches most cancers, misses a couple. Ultrasound misses a fair amount of cancers, but catches a couple, and the ones that it catches seem to have an overlap with mammography. So by adding an ultrasound, and I don't do this for every woman, it would be on a case-by-case type of a basis.
Depending on history and that kind of thing.
Depending on history, risk factors, and also psychological peace of mind, because there's something to be said for peace of mind in this business. Hey, my sister got diagnosed with, or my closest friend, I've known her for 30 years, got diagnosed with breast cancer, and I just want additional peace of mind. And we can provide that at our center with a screening ultrasound.
Now, if we can only figure out a different way to do mammograms than currently are done.
I hope that when I'm retiring in 10, 15, 20 years, I can look back at the turn of the century and say, I can't believe how barbaric we were. I hope we get something.
It's like slamming yourself in a refrigerator door. Other than that, it's a lot of fun. Thank you so much.
Thank you.
Is it not? I'm just saying, we need to invent a new way. Please visit our website after the show for a link to more about Breast Diagnostic Center in Auburn.